I'm Dr. Joseph Sutcliffe, and I am one of the radiologists that works for M&S Radiology Associates. We work with Baptist M&S Imaging and the Baptist Breast Centers, and I am one of the fellowship-trained breast radiologists that work at the six Baptist Breast Centers. So the FDA has recently come out with a proposed change to the Mammography Quality Standards Act, or MQSA, which was originally written in 1992 and it hasn't been updated in 20 years. And so they've come out with a proposed changes. So it's not law yet. They're asking for public input for any modifications to their changes. But basically, they've come out with a change that the most important one I think for patients to be aware of is they are requesting that all states provide breast density notification in the letter that goes out to patients after they've had their screening mammogram. The letter that says your mammogram is normal or benign, or your mammogram has a finding that you need to come back on. The FDA wants a paragraph in there that informs the patient of their breast density, because that's very important for them to know, and that informs them to discuss that with their referring physician. And we can come back to that more in detail. Okay. So again, probably the most interesting thing for patients to be aware of is the breast density change, which we can talk about in a little bit more detail in a few minutes. The other other items in that, it's about a 65-page document, are mostly kind of details more about the quality of the facilities that are providing screening mammography and diagnostic mammography, and some of the safeguards on ensuring that they're providing high quality exams. There were some measures in there to be more consistent in the wording of the mammography reports and how they report things, benign findings, or patients that already have a biopsy-proven breast cancer. There was basically wanted to be a very, very consistent way of reporting that throughout the United States and throughout all facilities, as there was a little bit of disparity between how places were reporting, different facilities were reporting that. So in terms of the most important changes for patients to be aware of here in San Antonio is the breast density part of the regulation. And the good news is it really is not going to change anything that you're already doing or that our facilities are doing, because this law has been a part of the Texas state laws since 2012. It was enacted. It was called Hinda's Law, and basically, so we've been in compliance with this since 2012. And basically, the law requires that every patient receive in their lay letter on their screening mammography report a paragraph about the density of the breast. Do they have dense breast tissue, or do they not have dense breast tissue? And if they have dense breast tissue, they are encouraged to discuss that with their primary care provider, not with the radiologist, not with the surgeon, but with their primary care physician, and discuss it, specifically determine if they have other risk factors such as family history that are additional risk factors, and then make a decision as to whether the screening mammography is enough for them, or would they benefit from additional supplemental breast imaging screening. And that's a conversation that should then be had between the patient and their primary care physician or primary care provider. Now, in terms of supplemental screening that's available and that we provide at the Baptist Breast Centers, for example, would be a whole breast screening ultrasound that looks at the breast using ultrasound rather than x-rays, which is a mammography is really just a specialized x-ray. And ultrasound is a different way of looking at the breast tissue and is a way for us to detect additional cancers. The benefit is we can detect more cancers with breast ultrasound. One of the drawbacks is that we also find a lot of additional benign findings in the breast that are not cancers, but we're not sure, and we either have to follow them very closely or we either have to do needle biopsies. And so the drawback is that women may end up getting more biopsies or having to return more frequently to get reassessed by ultrasound. So again, women with dense breasts and that you get in your let's say you get your lay letter, and your lay letter says you have dense breasts and you should talk about it with your referring doctor, and you go talk with your primary care provider, and you say, hey doc, what are the options that I can have? And one of those options would be ultrasound, which we just discussed, a screening ultrasound. Okay. Another option would be digital breast tomosynthesis, which also is known as 3D breast imaging. And a lot of you probably have already heard of 3D breast imaging. And basically what it is it's very similar to a standard screening mammogram, except that it also looks at the breast in different projections and allows us ultimately on the computer screen to look at the breast in very thin slices, like 1 millimeter slices, so that it also is very helpful in a woman who has dense breasts for us to detect a cancer that might otherwise be completely hidden. The other option is breast MRI. Now, breast MRI is a more expensive study. It's a little bit more time consuming and is generally reserved for those women who are at high risk for breast cancer. And what is considered high risk? Well, it's a woman who has, let's say, a strong family history of breast cancer. For example, a first-degree relative, a mother or sister who was diagnosed with breast cancer before age 50. If you have maybe one or two relatives like that you're potentially in a high risk yourself, or a known genetic mutation. And I think women are very familiar with the BRCA mutations, the BRCA mutations that, the Angelina Jolie had one of those, and so she made that, kind of publicized that. So if you have one of those genetic mutations, and it's not limited to that, there are many other genetic mutations that increase a woman's risk to breast cancer. But if you have one of those risk factors that increases your lifetime risk higher than 20%, that's a reasonable, it's a good reason to get screening breast MRI in addition to annual screening mammogram, not in place of. So why is breast cancer important? It's very important because it is the most common cancer in women besides skin cancers. It's the second leading cause of cancer death in women behind lung cancer. I think in 2017, about 260,000 women in the United States were diagnosed with breast cancer, and about 40,000 women died of breast cancer that year. It's very common. About 1 in 8 women can expect sometime in their lifetime to be diagnosed with breast cancer. 1 in 8, or about 12% of women. So it's very common. The good news is, because screening mammography, since that was introduced in the 1970s, has become really the standard of care, is to get screening mammography. Through screening mammography and in conjunction with advances in treatment, both surgical treatments and chemotherapy, radiation oncology, all those combined have decreased cancer mortality by almost 40%. And a big part of that is screening mammography, because if we don't have an effective way to prevent breast cancer at this point. There's really no vaccine to prevent it, but we can detect it early if you get your screening mammograms annually. And that the idea is, if you get a breast cancer, we want to detect it when it's very small and very treatable. And if you get a small breast cancer and it's detected on screening mammogram, your chance of surviving that is much greater than 90%. And I see women almost every day who are terrified that they've been diagnosed with breast cancer and are really concerned they're going to die. And the high likelihood is they're going to survive and do just fine with the appropriate treatment. So, how often should you get a screening mammogram is a very good question, and that's going to vary depending on who your referring provider is and what guideline they follow. I'll tell you the guideline that we recommend at the Baptist Breast Centers is we follow the guidelines of the American College of Radiology, the Society of Breast Imaging, and the National Comprehensive Cancer Network, which are 3 very solid institutions. And our guideline is basically that women of average risk for breast cancer should begin getting their annual screening mammogram at age 40 and continue getting that mammogram once a year as long as they live. No upper limit, as long as they're healthy. If you're 90 years old and you're in a nursing home and you have a lot of other medical problems, there's probably not a need to get that screening mammogram. But if you're 90 years old and you're vigorous and you're out jogging, every day, then keep getting your screening mammograms, because that may save your life. Because a lot of women think that the breast cancer is less likely to occur as you get older. That's not the truth. Breast cancer continues to be a risk into your old age, and actually increases in frequency the older you get. The breast cancers tend to be less aggressive the older you get, okay, but they still occur. So I want to make sure that's understood. But the risk of breast cancer never goes away, and therefore we follow those guidelines. Now, there are other guidelines out there. Some guidelines that recommend every 2 years starting at 45, or every 2 years starting at 50. Those are reasonable guidelines. We don't adopt those guidelines ourselves, but what's important is what your discussion with your physician and what your physician feels is appropriate for you. And we'll be glad to see you here on whatever frequency your physician thinks is the appropriate frequency for you. Let me get rid of this. So, breast density is determined by the mammogram, not by the way the breast may feel on self-breast exam, and actually not by the way the breast feels on clinical breast exam by the patient's primary care provider. The breast density, you can really only determine it based on how the breast appears on a mammogram. Now, the breast is made of mainly composed of two different types of tissues. There's fatty supporting tissue, which is dark, and here's an example of a breast which is one of the densities that's called predominantly fatty. And I don't have any patients' names up here, so this is all HIPAA compliant. And here's a breast on the right, which contains a lot of what is called fibroglandular tissue, or it's the tissue that produces milk when the patient is breastfeeding. But women have fibroglandular tissue in their breast throughout their entire lives, whether they're breastfeeding or not. And so you can see the breast here on the right that has the fibroglandular tissue is a lot whiter or brighter than the breast on the left. And the fibroglandular tissue is bright on a mammogram, and fatty breast tissue is dark on a mammogram. The issue with fibroglandular tissue is that it's the same brightness as a breast cancer. So a breast cancer is also white or very similar in color to the fibroglandular tissue. And so women that have breasts that are what we would call heterogeneously dense or extremely dense, meaning that more than 50% of their breast is composed of the white fibroglandular tissue, those women are, one, at increased risk for breast cancer simply because they have more of the fibroglandular tissue. Not a high risk, but at increased risk. But also important to us when we're interpreting mammograms is that it's more difficult for us to spot the cancer that is white when we have all of the fibroglandular tissue that's white in the background. It's much easier to spot a cancer in a breast that's mostly fatty. And so just wanted to show those two examples so that our women patients have a better understanding of what we're talking about when we're talking about dense breasts. And about 50% of women have dense breast tissue. It's not an abnormal thing. About 50% of women over the age of 40 have dense breast tissue. So it's not abnormal. I want to make that very clear. Dense breast tissue is not abnormal. It's just something that it is important for a woman to be aware of.